Hello, my name is Shan. I'm recording live from South Dakota. I'm here today to talk to you about the influenza vaccine, which is in the process of administration, and it has been called back for further screening. The second batch of the vaccine was suspected to have been contaminated with portions of viral capsids of the poliomyelitis virus in the packaging and the preservation process. The vaccination process has, with immediate effect, halted, and all the vaccine has been called back to our research lab. The individuals who have already been vaccinated or those showing mild symptoms of polio should contact the Center for Disease Control or the nearest Federal Emergency Management Agency, which is our FEMA office. The symptoms to look for include increased headache, fever, numbness, especially on the lower limbs, sore throat, and stiffness of the back, neck, and hands. Anyone with symptoms should not panic, since the CDC has already formulated an antipolio antivirus with a 100% effectiveness. The Federal Emergency Management Agency is working together with the Center for Disease Control and has formulated a concrete step-to-step process that will be followed by all the individuals administered with the contaminated vaccine, as well as those exhibiting the early symptoms of poliomyelitis. This includes the initial screening, which includes obtaining the blood samples from the patient. This is meant to ascertain the infection. If positive, the patients will start on an antiviral therapy that would include orally taken tablets. The screening and treatments will be held in all hospitals in the state. The service will be provided for free. And the process priority will be given to the individuals that have started experiencing the symptoms. Some of the patients with advanced infections might be forced to remain in the hospital for a few days for closer monitoring and observation. And for those who might have come into contact with the infected individuals, would also be immunized with poliomyelitis vaccine to curb the spread of the disease. And the vaccine will also be administered for free in every hospital and medical facility. The polio vaccine is safely guaranteed since it has been used time and again in the developing world where they are battling with poliomyelitis. With set up measures to ensure everyone will be handled and treated to avoid the prevalence of this forgotten disease. The general public is advised to remain calm and from any actions that may disrupt the process of treatment and immunization. The treatment to be used included a well-designed antiviral therapy that would ensure that the symptoms of polio in the next 48 hours cease. The procedure also ensures future encounters with the polio are usually handled by the body immunity, since double up as a vaccine. The antiviral drug has undergone several clinical trials within and across the globe, and the information collected from all of the trials were impressive. The efficiency of the drugs against polio patients was 92%. For the early diagnosed patient has 100% efficiency. The drug also have no further risk or adverse side effects to the users. The doctors and other medical practitioners dispatching the drugs will indicate the dose and the terms involved while under the antiviral drug. To family, friends, and relatives of the individuals who were administered with the contaminated vaccine should not be panicking, since the organization together with the Center for Disease Control has the situation under control. We have formulated the measures taken to mitigate the situation and ensure the patient was treated and discharged as soon as possible in the future to avoid the reoccurrence of such an event. Our vaccine to be administered to the general public will undergo an extra screening and sensitivity test to guarantee safety. The procedures will be handled by the Center for Disease Control and ensure the procedure is accurate.